Well, in the female genitalia, a lot of conditions can be disrupted. It could be because of delivery, it could be because of aging, it could be because of cancer or precancer, it could be about menopause. So many conditions can affect the genitalia. In the genitalia, what is the first demand is the reduction of the labia minora. With time, after delivery, the labia minora tend to elongate. On the non-surgery side, of course, all the conditions I have just mentioned before, the vaginal dryness or, for example, the labia majora flattening can be improved with mini-invasive technique as injection of filler, number one, hyaluronic acid, injection of PRP, platelet-rich plasma, or fat grafting. Thread lifting in the genitalia is not very common, but in the genitalia, some doctors start to use it, sometimes to lift the labia majora, sometimes to tighten a little bit the vagina, but this is just the very beginning. Maybe in 5 or 10 years, the use of thread lifting in the genitalia will be most popular. But so far, in 2017, this is a very small number of people who are using it. It could be a sexual dysfunction, of course. It could be urinary incontinence. It could be vaginal relaxation. It could be a painful scar. For example, it could be menopause with a vaginal dryness. It could be some dermatosis with a lichen sclerosis. So many conditions can be improved with the PRP. PRP is a very good friend with other techniques as filler, hyaluronic acid, fat, or laser or radiofrequency. So PRP has many indications. And we can really say that vulvovaginal area is an excellent area for an extensive use of PRP. Yes, so the use of filler, and the first of them is hyaluronic acid, is also more and more popular. After face, of course, there are a lot of indications. For example, the volumization of the labia majora, the treatment of the vaginal dryness, the treatment of the scars. Fillers, hyaluronic acid mainly, can be used for all the conditions previously mentioned, alone or in combination with PRP, because again, PRP and HA are very synergistic. PRP is potentializing the HA, and the HA is also good for the PRP. Of course, when a patient wants a more definitive result, we can move from the office-based procedure, PRP, fillers, to the operative theater procedure, fat, because fat you need to harvest the fat, where either in the tummy or in the posterior thigh. So we don't need a lot of fat, maybe we need not more than 100 cc. And then after centrifugation, we will have maybe 50, 60 cc, and we can re-inject this fat, as I told you, in the labia majora, in also the perineum if there is a scar, in the vaginal wall if there is a relaxation, if you want to provide a little bit of tightening. I would say that the first complication in the aesthetic gynecology field is the complication of labia minoroplasty. What are these complications? Sometimes when we cut the labia minora, we cut too much. So this is not reduction, this is amputation. And patients, they don't have any more labia minora, so they feel amputated. And very often they are psychologically very much affected. It could be a painful scar, so it can lead to a dyspareunia or even apareunia. They don't want to have sexual intercourse anymore because they are psychologically destroyed. Second possibility, minor complication, hematoma, infection, because this is surgery. And in surgery, you have always minor complication. And sometimes you have just, a small dehiscence. The wound after a few days is opening, and it can lead to minor deformation, and sometimes we need to make a little touch-up to fix the situation.